webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are represented in all of the projects and work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today, and I see that people are continuing to join our webinar, so let's give them just another few seconds and then we'll get started. This webinar is really all about getting answers to the questions that are on your mind. So before getting underway, I want to review how you can submit your questions. If you're connecting through GoToMeeting, you had two options to join the webinar, either by phone or using your personal computer. If you joined us using your personal computer's mic and speakers, you'll have the ability to submit your comments and your questions through the chat box that you should see on the right-hand side of your screen. If you happen to join by phone, then you're going to be in listen-only mode. Today's webinar is also being streamed live on Facebook. So welcome to everyone with us on Facebook today. We have a team ready to capture your questions and comments as well, so please feel free to post them. As I chat with our expert today, you can submit your questions as they come to mind, and we're going to address as many of those questions as we can. Now, I know that many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. I'll let you know how you can reach an MS Navigator before the end of today's program. Obviously, I can't make this webinar happen all by myself. There are a lot of amazing people working behind the scenes, and one of them is Julie Feel. And Julie's going to help me today by pulling together your questions in the background while I'm busy talking. We may even get Julie to read some of those questions herself. I should also mention that due to the large number of participants that we have today, everyone has been placed in listen-only mode. And if you're interested in reviewing today's discussion with our expert, this webinar is being recorded and it'll be available on the Society's website for your reference. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering. So I hope you plan on joining us each week. And hearing your questions and listening to what's on your mind is going to help shape future Ask an MS Expert programs. So I hope you're ready to participate. Our objective today, and our objective in all of the Ask an MS Expert programs, is to connect with you, share information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind, the topics that really impact people who are living with MS. When we read through your feedback on our previous Ask an MS Expert webinars and we look at the questions that we're continuing to receive, it's clear that COVID-19 will be a hot topic in all of our lives for the foreseeable future. So we're going to continue providing the latest updates on the key questions that keep coming up, as well as the new information that's trending in the news this week. We've received several questions about the impact of COVID-19 and MS on minority populations. So today, we'll try to better understand what's happening there. And of course, we're going to spend time answering the questions that are on your mind. We'll also share some key resources that you can turn to anytime for credible, reliable information about COVID-19 and MS. And before we dive in, I'd like to acknowledge that these are new and rapidly evolving times. So we do have a disclaimer to review. COVID-19 is a new coronavirus, and there are currently no published data available about the virus and MS. The information and recommendations presented in this program are based upon the professional opinions of MS experts and the evidence currently available about multiple sclerosis, infections, and disease-modifying therapies. This is a rapidly evolving situation, and we'll update information as it becomes available. The information that is shared does not substitute for your healthcare provider recommendations. Please check with your healthcare provider before making any changes to your treatment plan. And be sure to check the Society's website at nationalmssociety.org/COVID-19 to keep up with the most updated information on MS and COVID-19. Now, let's meet our expert. Dr. Mitzi Joy Williams is a board-certified neurologist and fellowship-trained multiple sclerosis specialist who is passionate about educating and empowering people affected by MS to understand the disease process and the goals of treatment. She's a sought-after consultant, speaker, researcher, and author with particular expertise in understanding MS in underserved and ethnic minority populations. Dr. Williams collaborates with national and international committees to advocate for people living with MS and to encourage partnerships between patients and their healthcare teams to improve shared decision-making to combat multiple sclerosis. Dr. Williams is also dedicated to raising awareness among patients, advocacy groups, and other organizations about the importance of research participation and encouraging diversity in clinical trials. And she's a member of the National MS Society's National Board of Directors. Dr. Williams, we're going on week 5 doing these sessions, and we're hearing from our participants that they want us to continue to update them on the latest information around COVID-19. With so much in the news, what are some of the latest things, I guess, that are coming up that people should pay attention to, or some of the things that maybe they shouldn't worry about?
Perfect. Thank you so much, John. And I'm so excited to be here with you today and talk about topics that are very relevant to many of those that I treat and many in the MS community. So let's just talk about a couple of things that have been pretty hot topics recently. One of them being the safety of takeout food. So certainly many of us who are now home recognize that somehow there need to be 3 meals a day. So I have 2 small kids, and sometimes that can be difficult. So takeout can really be a lifesaver and also helps the economy in those restaurants that may be struggling because there are not people supporting those businesses. So there are a couple things that people can do to remain safe if they're getting takeout food. So first of all, we don't recommend that anyone go to a restaurant and sit down with a crowd of people and eat. But if you are getting takeout, some of the things you can do is when you get home, certainly
Dr. Williams, I'm thinking we may have lost your audio.
you can't hear me?
Now I can. I guess
Okay,
all I
can
had
you
to
hear me
do,
now?
yes, all I had to do was say that, I guess.
Okay, gotcha. Okay, so maybe so we were talking about takeout food safety. So basically the things that you can do to remain safe if you're getting takeout is to make sure that any bags or containers that it was brought in are discarded as soon as possible, and that you put the food on your own plates, as well as make sure that you wipe down those surfaces. One other tip that's very helpful is if you're getting delivery takeout, to make sure that if someone is delivering, to try to have them drop it off at your door so you don't necessarily have to exchange touching hands. And then also, if you're going to give them a tip, try to do that through whatever app so that you don't have to hand.
I think we may have lost your audio again.
Okay, audio went out again.
And
Okay.
I keep saying that and it pops right back.
It
Maybe
pops right back as soon as you say it. Okay. All right. Let's see if I can adjust. All right. Why don't we just. Okay. All right. So let's see. Can we hear now?
yes.
Yeah. Okay. Is that better? We'll just do it old fashioned. I was trying to be a little fancy with my new microphone, and we'll just do it the old fashioned way. How about that?
Always good to have a plan B these days.
Absolutely. All right. So get rid of those containers. Give your driver or delivery person a tip before they come so they can just drop it at the door and keep moving. One other thing that's been a pretty commonly talked about topic is the use of CPAP. So CPAP is a machine, for those that don't know, that's used for people who have obstructive sleep apnea, meaning basically they're not getting enough oxygen and enough flow of air to the lungs while they're sleeping. And so one of the concerns about using CPAP with COVID-19 is that basically because the virus is transmitted through respiratory droplets, using that machine could put more droplets in the air, which could put other people at risk. So if someone does not have COVID-19, there should not be an issue related to that. But if someone did develop COVID-19 and they need a CPAP for obstructive sleep apnea, the main thing is, number one, to make sure that they speak with their physician about it to decide what plan they need to do moving forward. And in some cases, if they have a mild case of sleep apnea, they may be able to use other measures beside that machine to try to decrease the risk to other family members. But if they still need to use it, then they may have to isolate, especially at night, because using that could bring those droplets into the air and increase the risk of other family members who are in that household of developing COVID-19.
Makes sense. I know that treating COVID-19 with hydroxychloroquine continues to pop up in the news. What do we actually know about that?
Yeah, so there actually has been some more recent data that's been published or discussed about hydroxychloroquine. So there's been a lot of talk about it, and much of that talk was based on a very small French study that was done some time ago that suggested that it may help with this type of virus. Since all of this started, that paper or those results have been withdrawn because there were some issues with the methods by which they did that study or that experiment. I've recently seen two other experiments or studies in the news. One of them was another French study that had about 84 people in it. And that one suggested that it did not help with COVID-19 because they really did not see a difference in the outcomes in terms of morbidity and mortality, death for those who took hydroxychloroquine versus those who didn't. But there was another study that came out of China with about 150 people, and that one was kind of inconclusive. So I think that because of the small numbers, the jury is still out. I do believe that in the coming weeks, we will be seeing some more data, especially from some of our centers here where people have been using it, to give us more information as to whether we should be using it or not. As of right now, there are not recommendations from any of our societies that people should be using it on a regular basis or that people should be taking it as prophylaxis to prevent COVID-19. So there is not evidence that supports going out and getting a whole bunch of hydroxychloroquine because it can have some issues or side effects that affect the heart. So there are some potentially serious side effects. So we've got to get some more data about that one. And then a couple of other things that people have talked about are the convalescent plasma. So that's also a hot topic. So I'm in some doctor groups on Facebook and some other groups, and people are asking if those who have had COVID-19 and recovered could donate some of their plasma to potentially help someone else. And plasma is just basically a product of the blood. So when someone donates blood, they can separate it into different components. The idea behind that is that maybe there are some antibodies in that plasma from someone who has fought and successfully recovered from COVID-19 that may help someone to get through that. And so there are a couple of studies that are looking at this that are currently enrolling. I've not seen any definitive data yet, but since there's so much research and there's so much change on basically a daily basis, I do believe in the coming weeks that we'll begin to see some information about whether this is an effective measure or not.
You know, one important topic that we continue to receive a lot of questions about is the relationship between MS disease-modifying therapies and COVID-19 risk factors. A lot of people are wondering if being on their medication makes them more susceptible to catching the virus. Some wonder whether it's safe for them to stay on their disease-modifying therapy, and others are wondering if now is the right time or not to start a new disease-modifying therapy. For example, we heard from Carol, who asked, are people with MS more immune to COVID-19 if they aren't on a disease-modifying therapy? And Sue Ellen is wondering whether she should continue to get infusions, whether people on B-cell depleting therapies are more likely to get the virus and need a ventilator. What should people be considering if they have these questions?
Absolutely, and these are great questions. The honest answer is, and if you have been to any talk about MS or talked to your doctor about it or been in any community forum, you know, everyone with MS is different, okay? So there's not going to be a blanket answer for everything. So the first thing is that if people have concerns, they need to make sure that they're speaking with their healthcare providers, their neurologist or MS specialist about their specific case. Now, there are some general guidelines that have been published. The MS Society has some published on their website about disease-modifying therapies, and there are also some that have been published in different countries and different forums. What we are suggesting right now, or what the expert consensus is that certainly if someone is on a disease-modifying therapy, they should not stop that without consulting their doctor. So if you're at home, if you're taking injections, if you're taking pills, you should not just stop your medicine because of COVID-19 without consulting your neurologist first. So that's number one. Number two, in terms of adjusting the dosing of medications, each provider has a little bit of a different take on that. There are some recommendations that suggest maybe delaying some of the dosages of some of our depleting therapies if people are already on them, depending on how long they've been on them, until we kind of get a better feel of what's going on with the pandemic. But of course, that is an individual decision of that neurologist, because right now we don't have the data. So there's really not a right or wrong answer that's very clear. In terms of people starting new therapies, most of the guidelines and recommendations that have been published to date suggest that if someone is going to start a new therapy, that we would not, or we would really consider the risk of starting what we call a depleting therapy. So there are some of our medications that modify the immune system, may change kind of the types of cells that are you know, in one part of the immune system versus the other. And then there are some that are depleters, meaning they deplete or kill some of the cells. And all of those work in different ways to decrease the risk of MS attacks and relapses, et cetera. So what we recommend is that if we're considering one of those depleting therapies, you know, most of the guidelines recommend we don't start those right now unless there's a real compelling reason that you, the patient and their neurologist, discuss. So those are some of the things. Now, in terms of the medications, putting a person at increased risk for developing COVID-19, the reason that there are recommendations not to start those medicines is because it's a theoretical risk. So we don't have the data to really back that up. But the concern is that if we deplete part of your immune system and you then develop a severe infection, maybe you may not be able to fight that infection as effectively. Now, the flip side of that is that there are some theories that possibly the medications could actually help, because we know that when people develop severe complications from COVID-19, it's an inflammatory response that happens in the lungs. So there are some that suggest that maybe those medications may be a little protective because they are anti-inflammatory. Again, individual decision with that person's neurologist, but certainly we don't want to just stop anything without consulting your physician first.
I think everything you said is really important, but what I think is particularly important for people to hear is what an individual decision making any kind of change to your treatment plan really is, and how, because your neurologist knows you, knows
Right.
your disease course, knows all the details about your case, it's so important to have that conversation and then make the best decision jointly in terms of what happens next.
Absolutely. And it really is a revelation in progress. So, you know, many of my patients, we've said, okay, well, we may hold this off, but let's check back in 2 weeks. And we may have a paper that's been published by then, and we reassess. So it's an evolution in progress.
You know, more recently in the news, we're hearing about how minority populations are disproportionately being affected by COVID-19, And we've started to receive questions about this. Jesse asked which ethnicity is being affected most by COVID-19 and why. And Angela is also wondering if COVID-19 affects certain ethnicities worse or more than others. What can you tell us about how COVID-19 is impacting minority populations? And I'm hoping you can address Jesse and Angela's questions.
Absolutely. I would love to. So there is quite a bit of emerging data about the effects of MS, I'm sorry, not of MS, of COVID-19 in certain populations. And that's because it is a reportable disease. So on a nationwide basis, when people develop COVID-19 or they have complications or die from COVID-19, those things are reported. So it's really one of the few cases where we can really keep up in real time about what's happening in communities. And unfortunately, many minority communities are more severely affected. The one that's been most commonly in the news is the African American community. I certainly have seen some data that the Hispanic community may have morbidity, more mortality, and more complications in some areas of the country. But certainly across the board, for much of what we've seen in terms of data being published in different states, African Americans have a much higher death rate related to COVID-19. For instance, in Louisiana, there's about a 70% death rate in the African American community. In Washington, D.C., African Americans make up about 42% of the population and about 62% of the deaths. And also in Chicago, they make up about 40% of the population and about 70% of the deaths. So certainly very, very significant mortality in this population. And it really brings to light many of the health disparities that have been apparent for as long as most of us can remember and as long as most of us have been alive. So what are some of the reasons? Certainly, there are many reasons related to kind of the structural racism, housing, low quality housing, poor, access to healthcare that may be playing a part. But also there may be more higher risk of comorbidities in these populations. And that certainly we know can put people at increased risk if they have underlying diabetes, asthma. Those conditions may be have a higher percentage in this population, which could put them at risk for complications. And then the other piece is that often our minority populations disproportionately work in our services industry. So if you think about people who may be cleaning up the hospitals or working in grocery stores or working in the post office in areas where there's high contact with people, those essential services that remain open, they may have more repeated exposure, which also may lead to more mortality. So there are lots of reasons why. Certainly, there are lots of structural reasons, but also health and access reasons. But it really has brought light to this issue. And my hope is that with all of this data being collected and it really being in the forefront of people's minds, that it will eventually affect some policy changes that will help improve or decrease some of the disparities in our health outcomes.
Well, some questions coming through are about what the differences are in how MS impacts minority populations. So maybe we can broaden our conversation a little bit. Gabriella asked, are there differences in how MS impacts different ethnic groups? Evelyn wants to know if there's any research happening around the impact of MS on minorities, and is there any correlation to what we're seeing with COVID-19? So more of what we've been discussing.
Absolutely. So the short answer is yes and yes. So for the first question, there are some differences that we've seen in the literature related to MS in minority populations. I'll talk first a little bit about the African American population, and then I can also touch a little bit on the Hispanic population. We don't have very much data about other minority populations, such as the Asian population, as well as the American Indian population, but we do have a fair amount in the African American and the Hispanic populations. So what we know is that in terms of risk for MS, actually there's data that's emerged over the past 10 years that suggests that risk for MS is highest in African Americans here in the US. Now worldwide, we know that the risk is highest in parts of Europe, particularly Scandinavia. But here in the US, we found that MS is higher in African American women particularly. And so the risk can be up to 46% higher. In terms of the outcomes or kind of how the disease presents itself or behaves, some of the things that we've seen in the literature literature are that African Americans tend to have more motor symptoms, difficulty walking at the onset of their disease, which can lead to more disability over time. We've also seen that there may be a shorter time to walking disability, meaning needing a cane or a wheelchair for African Americans, and that can occur 6 to 10 years earlier than white Americans living here in the US. Also, there are data that suggests that there's more MRI disease burden and that people just may have a more severe course of disease over time. One of the difficulties, John, is that even though we have this data that suggests that we see worse disease in African Americans, we don't have enough data to tell us why that's happening. It's not really clear if it's because of some biologic basis, like are there some differences in the genetics that may be affecting this? Or is it really more related to the social determinants of health? So those things that are also leading to the worst outcomes with COVID-19. So in terms of a correlation, that would be the correlation. The fact that, those things such as access to care, treatment for comorbidities, all of those things can affect what we see in outcomes. And we really don't have a good idea of what is the larger factor that's playing a part in African Americans. In terms of the Hispanic American population, although there may be a lower risk of MS in this population, we also are seeing more severe disease in terms of optic neuritis and spinal cord disease. So there are many of us who are studying these things diligently, trying to figure out how we can definitely treat all of our MS populations more effectively. But I think that, we've got a long way to go. We've come a long way, but we definitely have a long way to go in understanding how MS really works in these populations.
Well, I see we have some questions that relate to things people are concerned about in the days and weeks ahead. Selena wants to know, my schools are opening next week. How am I supposed to deal with that? Who should be wearing masks?
Right. So right now, as per the CDC recommendations, everybody should be wearing them. Now, the difficulty is that masks can be very hard to come by at this point in time. Certainly the ones that we know really protect people from COVID-19, which are the N95 respirator masks, are recommended to be conserved for the healthcare workers who are in the hospital because there's a shortage of those. So we would not recommend that people try to acquire those in the community, which would, take resources away from those who are treating people on a regular basis. But certainly cloth masks. It may be difficult to wear a bandana to school, but certainly, it is recommended that people wear some type of face covering if they are out in public, to try to basically at least keep their secretions in so that they're not breathing on other people and possibly putting them at risk. So it doesn't necessarily keep you from getting droplets from other people, but it certainly keeps yours to yourself so that you don't infect someone. And then social distancing will be extremely important, especially if schools are reopening.
Jane would like to know, can she be taken out for a walk in a wheelchair during the pandemic?
So there are many people who are getting out and getting a little bit of fresh air and a little bit of exercise. Again, social distancing is going to be key. Every state has a little bit of different regulations. So for instance, I live in Atlanta, Georgia, and we have a nice park across the street. And most of the time, if people are walking, they try to keep that distance. Or sometimes, in terms of myself, I try to go at off times where there aren't very many people there. So I can go very early in the morning and there may not be anybody there but me or one other person. So going for, walks or going out in your neighborhood should be fine. Certainly, I would not recommend going to a large crowded area or during a high traffic time where there are lots of people walking around or, that could be close to each other.
Dorothan would like to know, is being indoors better than being outdoors? Or is it okay to be outside, but just stay away from other people?
Right. So the point is to stay away from other people, right? So if people are not breathing and putting droplets into the air,
the risk theoretically would be very low. The difficulty is that it's hard to go outside and stay away from people. So that's the issue. So certainly being inside is good. But if you can go outside to an area that's not crowded, or for instance, we have a deck in the back of our house, or sometimes my kids will play in the front yard if no one else is out, then it's fine to go out. But the point is to stay away from other people that are not within your home and living with you, your family.
Patricia is looking a little bit ahead. She wants to know, when the crisis is over and shelter at home orders are lifted, but before a vaccine is created and available, how should those of us on immune suppressing drugs approach that return to work, as COVID-19 will still be a possibility out there, but it may not be seen as an epidemic threat?
Right. So it's a difficult question. And the honest answer is, there's not really clear guidelines right now. I think that honestly will have to be made on an individual basis. For instance, I have some patients who are on medications that deplete the immune system. And depending on the data that we get, so there are registries that are going on and developing right now. So there's an Italian registry that has over, I believe, 200 people in it already. There are global efforts to kind of join all of our information to get a better understanding of how our patients are either improving from COVID-19 or being affected by COVID-19, who are on different disease modifying therapies. My hope is that by then we will have some more data to kind of help inform our decisions. But again, individual basis. If it's someone that works in a very high traffic area that's on a suppressive therapy, there may be some, conversations with you and your physician about, should there be a time where you're not working when you first get your medicine before you go back to work, or would you just go back to work? So it really is going to depend on the person. But I do believe that we will have some more data because we're getting data that's coming out, as I said, on a weekly basis by then.
Tammy is asking, what have we learned from those with MS who have gotten COVID-19? Are the outcomes any different than for those who do not have MS?
So right now, much of the data is what we call anecdotal. And honestly, one of the greatest places where people are putting some of their data is on Twitter. Twitter has been quite an amazing source of information, and many of our colleagues from all around the world have been sharing, just kind of what we call anecdotes of some of their patients who developed COVID. What we're hearing is that people who are on all different types of disease-modifying therapies have developed COVID. People who are on all of the therapies have improved, and people who are on all of the therapies have potentially had mortality and passed away. So there hasn't really been a good rhyme or reason to tell us that people absolutely, if you're on a certain therapy, that you automatically will pass away from COVID or that you automatically will improve. So we've had people on injectables to the infusions who have passed away, and people from injectables to the infusions who've recovered successfully and had mild symptoms. I think the main factor that I've seen across most of the data is that age seems to be the unifying risk factor that we've seen. So people who are over 65 have a higher risk of having more complications independent of the disease modifying therapies they are taking. But certainly we will be getting, as I said, more of this data in the coming weeks, and the efforts are moving very rapidly for people across the world to enter information about their MS patients. And there are also efforts where people living with MS can submit survey data to help inform what we know about COVID-19 and multiple sclerosis.
Now, Martha asks whether people with MS are more likely to experience the cytokine storm from the COVID-19 virus because people with MS have immune systems that may react more strongly to incoming viruses than someone without MS with an average immune system. So here's an opportunity to talk a little bit about what that cytokine storm is, and then whether people living with MS are more likely to experience that.
Absolutely. So the cytokine storm, we actually see that with withdrawal of some of our medications for MS. So for instance, with one of our IV medications, if someone were to withdraw it and kind of have what we call rebound disease, they develop this cytokine storm where they have a very severe inflammatory reaction that can be even more severe than what they were having before they started taking the medication. So that cytokine storm is a very strong inflammatory reaction. We see it primarily with COVID-19 in the lungs, which causes respiratory distress and is why people often have to be put on the ventilator, which helps them breathe so that they can be, they can heal and get through that. Now, with MS, there's not necessarily an increased risk that we know of someone developing cytokine storm. But what we do see, or that is kind of where the theory has arisen, that maybe some of our medications may actually help prevent that, because the MS therapies that we use are anti-inflammatory, and some of them work in different parts of the body, even some of them have effects in the lungs. So actually several of the MS therapies are being tested as treatments for COVID-19. So actually that's where that theory comes in, that medications may be helpful, but we don't necessarily have evidence, as I said, that it makes you more likely to develop cytokine storm itself just by nature of having multiple sclerosis.
Denise wants to know, are immune system boosters designed to minimize the occurrence of colds okay to use for people with MS?
So again, if you take any type of supplements, you should run it by your neurologist or your treatment team first. Generally, in my experience, I don't necessarily advise my patients to take boosters necessarily, because oftentimes with MS, your immune system is doing too much. So the problem with MS is that your immune system is overactive or doing the most, as some would say. So, if our goal would not necessarily be to boost or increase immune function, but certainly those particular supplements in terms of ingredients and things like that, you would need to run by your neurologist and make sure that they're okay with it and get their opinion about it.
I think I know how you're going to answer this question, but because it's being asked again, I think it's worthwhile that we talk about it. Someone would like to know whether people with well-managed relapsing remitting MS should continue on their disease-modifying therapy now.
Right. So if it is well managed, do not stop your therapy, okay? Keep doing what we're doing. As my mom likes to say, if it ain't broke, don't fix it, okay? If you have concerns, speak with your neurologist. If you have concerns about the type of medication you're taking, whether it's a depleter or whether it's a modifier, just make sure that you talk to your neurologist about those. Many neurologists are doing virtual visits, even though the offices are closed. There are many that are still able to answer questions and concerns, but we do not recommend that anyone just stop their therapy, especially if it's working and you're stable.
Mark read about a study being done to look at Bacille-Calmette-Guerin vaccine for COVID-19. Do you think there is any potential there?
Say it one more time, John.
BCG, Bacille-Calmette-Guerin.
Okay, gotcha. So there are other vaccines that are being looked at. So there are trials to develop a COVID-19 vaccine, but there are also trials where they're using vaccines for other viruses or illnesses to see if those will potentially also protect against COVID-19. Those trials are in super early preliminary states. So I don't know that we'll have any data about those being effective for some time, because vaccines really take time. It takes time to see how they work, which is why most of our experts have suggested that we really won't see a vaccine probably for 12 to 18 months out from this.
Well, here's an interesting question from Jessie, who did have a conversation with her neurologist, who told her to take her Gilenya every other day. But she's read that a half dose gives you 3 times the chance of a relapse. Wants to know, what should she do?
Well, listen to your neurologist. So I can't necessarily give specific medical advice, but certainly that is a concern. Now, there's one thing that we know. There are absolutely data and studies that tell us how to prescribe certain medications, right? But one of the reasons that we specialize, well, hopefully one of the reasons that you see someone who specializes in MS or a neurologist is that you also trust some of their clinical experience. Many of us have seen hundreds or thousands of people living with MS, and there's a lot of what we call anecdotal information that runs around in our communities. So there are many times where people have adjusted the dosing of certain medications, and they have found it to be effective in particular patients. I'll give you a good example. One of our infusion medications actually has data now that suggests that we could possibly extend the dosing from every 4 weeks to every 6 weeks. But there were many neurologists and specialists who were doing that prior to the studies being published. So sometimes it takes a little while for the actual data to catch up with what people are doing in the community. But again, if you have concerns, it never hurts to talk to your neurologist about it again. But oftentimes we're adjusting those doses and we're doing different things on an individual basis for our patients, especially because we want to try to keep people as safe as possible during this pandemic.
Well, and I think, again, that to underscore what you just said, when someone reads the outcome of a study, they're reading how a group of people, sometimes a very large group of people, reacted in a given situation. Your healthcare provider has been observing how you react, and therefore they may have an opinion based upon how you are, who you are, and how you have been shown in the past to react to certain things. So what they're doing is designing something personalized in the way of treatment that really will benefit you the most.
Right, absolutely. I agree wholeheartedly.
Well, Paige has asked a question that actually an awful lot of people have asked, so I will read hers, and she can stand in for a crowd. Paige wants to know, how do you deal with anxiety during the quarantine?
Great question. So there's a lot of anxiety, related to, so oftentimes there's a lot of anxiety just related to having a diagnosis of MS. So many of my patients deal with depression and anxiety outside of a pandemic. We know that those things are at increased risk for having a chronic disease like MS. So you add on top of that a pandemic of this virus that we can't see. You can't leave the house. You might be cooped up with your 3 and 6 year old like me and homeschooling. Even if you're not, it can be very difficult. So there are lots of different ways to deal with and cope with that. I think the first thing is recognizing that's a problem, okay? Reaching out to your healthcare team. There are resources that are available. There are many counselors who are doing video visits for those that need some type of counseling during this time. If there are medications that are needed, your doctor may be able to talk to you about those, prescribe them. The other thing that I recommend is that even though we're social distancing, we don't have to be emotionally distanced from our family and friends. And so I found really innovative ways to kind of do 3-way calls with my friends. If we have some type of video chat, 3 of us may get on there and have a pretend happy hour or, kind of a mommy wind down. So we still can remain emotionally connected, either through talking to people, catching up with friends that we may not have had time to catch up with in a long time. And also there are many online communities. Also, John, I'll give a plug for John, has done some excellent podcasts, one of which is talking about how to deal with the anxiety related to COVID. So there are many resources that are available, but if it's significant, make sure you reach out to your healthcare provider because you may need some counseling, and or some medication. And if that's not, then, making sure that you're reaching out to that social network that you have.
Audrey is asking for some specifics about sound nutrition. She wants to know, does poor diet cause or result in an MS exacerbation? And would also like to know what and what not to consume to best manage your MS.
Yeah, so this is a very common question that I get very frequently, especially for people who are just diagnosed or for people who've had MS for years. So there's a great page on the MS Society website that talks about many of the different diets, and it talks about nutrition and multiple sclerosis. So there's not one particular diet that we have a lot of evidence for that we could say necessarily makes MS better or one that makes MS worse. There's a lot of information going out around about Mediterranean diets, gluten-free diets, paleo diets, diets where you eat a lot of liver, intermittent fasting. There are different diets every year. The bottom line is, the best things that you can do is eat healthy, raw foods, right? So stay on the outside of the grocery store and less processed food. And that often is the common denominator amongst many of these diets, and they have kind of their different little tweaks on them. I've had patients who've been on every diet that you can think of and been successful and done well. My motto is most of the time when we're putting it in our mouths, we know if we should be eating it or not, right? So, that cupcake that I ate just before we had this talk, probably shouldn't have ate it. But if you eat a nice green salad, then that probably would be a better choice. But certainly there are also resources, nutritionists, dietitians, and oftentimes your neurologist can refer you to somebody if you need specific information for a particular diet. But oftentimes, health, fresh, raw foods are often going to be better than processed foods. And looking at that website that has some good information can also be helpful.
Great. Well, as I said when we got started today, while I was busy talking, my friend Julie was in the background catching the questions that I can't quite grab quick enough. So I'm wondering, Julie, what else are you seeing come through right now?
Thanks, John, and thanks, Dr. Williams. That's been incredibly informative. We do have several other questions that did come in while you were chatting. First, we have a question from Janine, and this is going back to another question we had from someone asking about returning to school next week. And one of the suggestions or one of the questions we had was about wearing masks. So Janine is asking if you have any specific thoughts on carbon filter masks.
Yeah, so, the difficulty is we know that there is one type of mask that really does protect someone from developing COVID-19. And those are the N95 masks that that our healthcare workers primarily are using who are in the hospitals. In terms of many other different types of masks, there are some that have different levels of filtration versus others. We know that there's potentially going to be some risk with any other mask besides that one. And even with that one, people are supposed to be fitted for it. So even if you just came upon some N95s, if you weren't specifically fitted for that size, it still may not be effective. So, other than those, hospital grade ones, there's always potentially going to be some type of risk. There are lots of different masks that have popped up over time. There's also difficulty with knowing if they're actually what they say they are versus not. But definitely some type of face covering, whether it's a carbon filtered mask, whether it's a cloth mask, would potentially help keep your respiratory droplets in. And then in conjunction with that, it will still be very important to practice that social distancing as much as possible. That's the main thing that's going to help us to decrease the spread of coronavirus at this time.
That's very helpful. Some of your comments about masks just highlight there's so much that we still don't know. And as we've talked about in previous weeks, that uncertainty just breeds anxiety for all of us. And so Barbara's watching us today on Facebook, and she wrote in to ask, for those who are experiencing low levels of anxiety, could that anxiety cause her MS symptoms to worsen?
So there's often questions about whether anxiety or depression or extreme stress could actually lead to an MS relapse. We do not have evidence that anxiety and stress lead to an MS relapse in the sense of making you have new lesions in your brain and spine. However, anxiety, depression, and stress can temporarily make your symptoms worse. So if you think about most conditions, stress and anxiety make them worse. So if people have headaches or they have migraines and they're very stressed or have anxiety, it will often kind of flare those things up, but may not necessarily cause a whole new condition. So the short answer is no, we don't have evidence that stress and anxiety causes an MS relapse, but it can cause temporary worsening of symptoms. So we certainly recommend that people try to do things to relieve that anxiety, whether it's doing a little bit of exercise, whether it's making sure you get some sleep at night. There are many different apps out there that help with meditation. That can help decrease anxiety, and also reaching out to your healthcare provider for resources as well.
Very helpful tips. Thank you. We have a question about disease-modifying therapies, and this one comes to us from, it's either Shayna or Shauna, I'm not sure how to pronounce it, but she takes a DMT that can decrease her white blood cell count. She and her husband also both have allergies, She says her entire family gets the flu shot annually, but she's still very anxious when her husband or even she herself just slightly coughs. She's wondering, should she be concerned? I guess the question really is when to be concerned that it's more than just allergies.
Right. So, I live in the South and we have lots of trees, and those trees have bloomed overnight. So I definitely know about allergies, but oftentimes if we have allergies, we kind of have a sense of our baseline in terms of symptoms. Sometimes there can be a little cough, a little runny nose, in terms of distinguishing that between a COVID-19 infection, certainly the things that would play a part would be if someone had a fever, if they were becoming short of breath. Those type of symptoms would lead you more to think of an infection versus just your regular seasonal allergies. And then also making sure that you're doing the appropriate things to treat seasonal allergies, if that's something that you do, would also help kind of distinguish between the two, because certainly allergy medicine would not decrease the symptoms of COVID-19. Again, if you have more concerns, if you feel like you're continuing to get sick and not getting better, you always should reach out to your healthcare provider, for some advice. And many healthcare providers are, taking consults because people are very concerned about the symptoms. But I definitely understand, that cough can be concerning.
Great, thank you. We have a question from Maria. She's wanting to know if the virus can affect a patient neurologically.
So if you had asked me that about 3 weeks ago, I would have said no. But because it is a rapidly evolving area of information, there have been several reports of people having neurologic symptoms related to COVID-19, which has actually affected some of the recommendations from some of our experts about our disease, some of our other experts about disease-modifying therapies. So the short answer is yes. There are some cases that have been reported of meningitis, a case of encephalitis where someone had confusion caused by, infection near the brain. And then there also has been a case of what we call Guillain-Barré syndrome, which is a syndrome related to weakness that can happen after someone has had an infection. So there are increasing cases of neurologic symptoms. The other symptom that has been a little concerning is stroke, which is not thought to be due to the virus itself, but the virus can make people be at increased risk for developing blood clots. And we know that strokes are often due to blockages of blood flow. So there have been some neurologic cases or symptoms that have been reported. It's not been extremely common, but certainly is something that we as neurologists are looking out for and trying to learn more about.
Great, thank you. This next question is about testing. And so we know that there are local and national guidelines around who's getting tests these days, but I'll just ask David's question. If someone has comorbidity with both MS and diabetes, do they fall into a higher priority category where they should be getting tested for COVID, for the virus or for antibodies, regardless of the lack of symptoms?
Right. So there really is not currently a push for asymptomatic testing. There are many health experts that suggest or recommend that we should be doing asymptomatic testing. Fortunately, there are more and more companies who are developing tests that are becoming available. But as of right now, many centers and hospitals are still testing people who are symptomatic. And even some people who are symptomatic are not being tested if their symptoms are mild. So this will really be kind of a revelation in progress in the coming weeks as the number of tests increase, who will be tested asymptomatically. But right now, there's not a huge push. There's not a huge amount of people who are asymptomatic who are being tested.
Right, thank you. Alessandra is asking if or when a vaccine is available for COVID-19, can MS patients who are taking a disease-modifying therapy get the vaccine?
So it depends on what type of vaccine it is, and the recommendations, again, this is really a revelation in progress. So this is really a theoretical answer, but we do often recommend vaccines, especially vaccines that are not live for many of our MS patients. So we recommend people get the flu vaccine. If it were not a live virus, certainly there'd probably be a uniform recommendation to get it. If it were a live vaccine, then certainly many of our consensus committees would make recommendations, but more than likely, because of the potential deadliness of this virus, it more than likely would be recommended that people with comorbidities and chronic disease do get it.
Well, thanks, Julie. And thank you, Dr. Williams. I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is reliable. So,
absolutely.
Yeah, so we'd like to share some resources, and these are resources that you can count on to be credible and current. So let me first circle back to something that I said earlier. If we were unable to get to your questions today, please know that the National MS Society's MS Navigator team is available to answer the specific questions you have, and they can connect you to the very best resources. You can reach the MS Navigators through the Society's website, by email at contactusnmss@nmss.org, or by telephone at area code 800-344-4867. You can always check the Society's website at nationalmssociety.org/COVID-19 for complete updated information on COVID-19 and MS. And you can visit the Centers for Disease Control and Prevention website at cdc.gov for the latest information about COVID-19 from the federal government. This is our 5th Ask an MS Expert webinar. And if you'd like to review any or all of the past webinars, as well as this one, you'll find the video replays at the MS Society's website. And that'll be at nationalmssociety.org/MS Expert. And you'll want to spell MS Expert as all one word. Now, if you'd like to connect with Dr. Williams, you can find her at www.drmitzijoymd.com, and you'll want to pay attention to the spelling that's up on your screen to make sure you get to where you want to go. And you can also find her on Facebook at facebook.com/thenerdneurologist, on Twitter at nerdyneuromd, and on Instagram at the Nerdy Neurologist. And finally, every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you take a few minutes and give Real Talk MS a listen. You can find the podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts and audio content. And Dr. Williams, sorry, but I have to ask you about those social media handles. What can people expect when they check out the Nerdy Neurologist on Instagram? And what can you tell me about how you decided on that name?
Well, the interesting thing about it is that, I am definitely a nerd at heart. So most of the time when people meet me and talk to me, I have a wide variety of interests. I sing, I play instruments and all those type of things, but they would never imagine that I was a typical neurologist, because I truly am a nerd. And so when I hear things about myelin, and I get so excited. So I like it because it's a bit of an oxymoron, because I don't quite look like a nerd, but I am definitely a nerd at heart. So I am a nerdy neurologist at heart. And certainly on my site, I post information, especially about webinars that I do like this related to MS. I also post information about some of the relevant research that's going on. And then every once in a while, you might see a picture of me with my kids kind of doing something regular. So we definitely keep it lively, but we keep it informational as well.
Well, that sounds great. I can tell you, I'm one who looks to your social media accounts when I'm looking for information for my podcasts. So they're full of good information and some really interesting photos. So yes, I hope everybody has a moment to check that out. Well, absolutely. Thank you, Dr. Mitzi Joy Williams, for sharing your knowledge and insights with us today. I'd like to thank everyone who's joined us for your great questions, your remarkable level of engagement. Please remember that a recording of this webinar is going to be available for your review on the Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future webinars. The survey only takes 1 minute, and it makes a huge difference. So please take a minute and fill it out. On behalf of Dr. Mitzi Joy Williams and the National Multiple Sclerosis Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.
Absolutely.